Welcome to this overview of the Adult ADHD Self-Report Scale version 1.1, specifically the 6-question screener. This tool is based on the work of Kessler and colleagues as part of the World Health Organization's research. Research suggests that symptoms of ADHD can persist well into adulthood, significantly impacting relationships, careers, and even personal safety. Because this disorder is often misunderstood, many adults who have it may not receive the right treatment and might never reach their full potential. Part of the challenge is that ADHD can be difficult to diagnose, particularly in adults. To address this, the Adult ADHD Self-Report Scale, or ASRS, was developed in conjunction with the World Health Organization. This effort involved a dedicated workgroup of psychiatrists and researchers, including Dr. Leonard Adler, Dr. Ronald Kessler, and Dr. Thomas Spencer. The tool we are focusing on today is the ASRS version 1.1 6-question screener. It's a concise subset of the original 18-question symptom checklist. Through research, these specific 6 questions were found to be the most predictive of symptoms consistent with ADHD, forming the basis of this efficient screening instrument. The purpose of this screener is twofold. First, it serves as a valuable tool to help screen for ADHD in adult patients. Second, it is designed to provide critical information that can supplement and enrich the overall diagnostic process. Let's talk about how the screener is administered. It is intended for use with adult patients, meaning those who are 18 years and older. A key advantage is that it is self-administered, which makes it very practical for clinical use. It's also incredibly quick, taking less than 5 minutes for a patient to complete. Because it's so straightforward, you can even provide it to tech-savvy clients online, allowing you to remotely monitor their status. The questionnaire itself is designed to be very clear and focused. It asks the individual to select the option that best describes how they have felt and acted over the past 6 months. The questions are consistent with DSM-IV criteria and specifically address the ways ADHD symptoms manifest in adults. The content reflects the importance that the DSM-IV places on symptoms, impairments, and history for an accurate diagnosis. Now let's look at the scoring and interpretation. While an earlier scoring system existed, an alternative method using a 0 to 24 scale was found to be more robust and reliable. This system assigns points based on the frequency of each symptom, with 0 points for a never response, up to 4 points for very often. The points from all 6 questions are then summed to get a total score, which can range from 0 to 24. A score of 14 or more is considered a positive screen for ADHD. To provide more detail, the total score can be classified into 4 different levels or stratum. A score from 0 to 9 is in the low negative range, 10 to 13 is high negative, 14 to 17 is the low positive range, and 18 to 24 is the high positive range. It is very important to understand the limitations of this tool. The ASRS screener is not diagnostic. As a healthcare professional, you can use it as a tool to help screen for ADHD in your adult patients. The insights gained from this screening may suggest the need for a more in-depth clinician interview. While the checklist only takes about 5 minutes, its true value is in providing information that is critical to supplement the complete diagnostic process. This is where PsyPack can make the process much easier for you. You can initiate the assessment with just a few clicks, sending it directly to your client via email. You can also set the assessment to repeat at fixed intervals for ongoing monitoring. The client then completes the assessment online through a simple interface. And as soon as they finish, a comprehensive report is generated and ready for you to review. Scoring assessments by hand can be complex, and errors can happen. PsyPack automates the scoring and instantly generates an interpretive report so you can spend your time where it matters most, with your client. The report includes a color-coded response sheet, which helps you see the most pressing symptoms at a glance. Items marked in red, for example, represent the most severe symptoms. The graph also uses different shapes, like circles and triangles, to distinguish between the inattention and hyperactivity impulsivity domains. You also receive the total score and its corresponding stratum, which is plotted on a clear, color-coded scoring graph. This visualization helps you grasp all the essential information with just a quick look. But that's not all. If you repeat the assessment with a client, PsyPack also plots a track progress graph. This graph shows the score on the vertical axis and the date of the assessment on the horizontal axis. The background colors reflect the scoring stratum, so you do not have to look back at previous reports. With just a glance, you can easily track the client's response to your interventions over time. To explore these features, you can create a free account on PsyPack.com. Follow us for staying ahead with psychological assessments and tools. Thank you.